This is a good question. The question is there any evidence that stimulants were correlated with improved response for inhibitory stimulation like 1 Hz right DLPFC, or has this been studied in high-frequency RTMS? Intuitively, it seems like a stimulant would do the opposite of what an inhibitory stimulation is trying to do. Okay, that's an excellent question. I like it. That means that you're paying attention, right? Because 10 Hz stimulation is stimulating. Remember, we're given 10 rips basically per second, for 40 rips for 4 seconds, and then we're taking a break, and then we're taking another set of rips, right? So it would stimulate that area of the brain. While if we're doing low frequency TMS, so continuously we're going with 1 click every second, for 15 seconds, 20 seconds, for 15 minutes or 20 minutes, what have you, and that will inhibit that area of the brain. So this person is asking, remember when you told me that if you give a stimulating medication, like a stimulant, like, say Adderall, Concerta, or something of this sort, isn't that going to cause the opposite if we're doing inhibitory TMS? Well, okay, there was a video that I did on laterality of treatment when I explained to you the balance between the two hemispheres, okay? And I apologize again for the right and left, sometimes the camera would flip them, okay? So to treat depression and anxiety, I have, usually there is imbalance between the left and the right. So I can either activate the left to go back to that balance, or I can inhibit the right to go back to that balance, and that will solve both problems, okay? So if I'm doing inhibitory treatment on the right DLPFC, I'm actually treating depression as well, okay? So in the study that I shared at that time, let me see if I can put out on the screen. Okay, this is the study that I shared into about use of medications during TMS and how stimulant medications will have positive effect while benzodiazepines could have negative effect. And that's the section in here that at 2 weeks to 6 weeks of the treatment, the medication, this medication category, meaning stimulants, you can read it in the previous page in there. This medication category may be more likely to be associated with RTMS outcome for depression regardless of treatment duration or side or frequency of the stimulation. So majority of patients were left-sided high frequency, but there were, I think, a little bit over 20% who were right-sided low frequency. So it did not matter, if you give a stimulant, you still have better effect. So again, inhibiting the right DLPFC means stimulating the left DLPFC, or at least that's the theory of how this works. Okay. Disclaimer: although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.